Good afternoon, Dr. Berger.
Good afternoon, Irina.
So there is a myth that if you start GLP1, you can actually, after you maintain your goal in terms of weight, you can stop the GLP1. What are your thoughts?
So, for over 10 years, we've considered obesity to be a chronic disease, not unlike high blood pressure. So, for example, if I get somebody's blood pressure down with an antihypertensive medication, we don't say, hooray, your blood pressure is normal and stop the medicine, because most likely the blood pressure will go right back up unless they've been able to make significant enough lifestyle changes that they don't need the medicine any longer. But a lot of people, most people, they have to continue those kinds of medicines throughout their lifetime. And with obesity, for a number of physiologic hormonal reasons I won't get into here, basically most people are likely to regain if they stop the medicine. There's maybe 5 to 10% of people who can maintain their weight loss, for example, after stopping Zepbound. But most people are going to need at least a maintenance dose of medication. So we might be able to taper down and then see what happens. If a patient starts to gain weight, though, we need to go back up on the dosing, because if every time you go through a yo-yo cycle, you lose and then you regain. Every time it gets harder to lose the weight the second time, because your resting metabolic rate always goes down after each cycle. So long story short, we need to think about treating obesity as a long-term endeavor. A lot of people, most people, will probably need to be on at least a small maintenance dose of the medication to avoid weight regain. There are a few people who might not, but that's always something that should be done under the close supervision of your doctor, so that you don't go through those cycles and it gets harder and harder to lose weight. So if you have further questions, please feel free to reach out to us at Northeast Medical Practice, 516-604-3418, or visit us online at northeastmedicalpractice.com. As always, all the information that I provide on these videos is for educational purposes only. We have not formed a doctor-patient relationship, and if you have specific concerns or questions, don't hesitate to reach out to your medical professionals. But until then, next time, be in good health.